Professional English in Use, Chapter 9, Hospitals, Introduction to a Hospital. Jordi Pons is a fourth-year medical student from Barcelona. He has come to Britain on an elective attachment to the Royal Infirmary, Edinburgh. Dr. Byron is introducing him to the hospital. Dr. Byron, the Royal Infirmary is the name of the university hospital for Edinburgh University. It is a general hospital dealing with all types of patients and illnesses, except pediatrics. We have a specialist hospital for that in another part of Edinburgh. The hospital for sick children. You can see some of the departments in our hospital on the sign. Of course, there are many others, for example, the intensive care unit, ICU, and the surgical high dependency unit, HDU. Jordi, what does outpatient mean? Dr. Bayron, outpatients are the people who come to hospital to attend a clinic or to have tests of treatment, and then return home on the same day. Inpatients stay in the hospital for 1 or more days. The rooms where they stay are called wards. If a patient's treatment requires only 1 day, such as a simple operation, they can be admitted to the day surgery unit. Welcome to the Royal Infirmary. South entrance. Car. Welcome to the Royal Infirmary. South entrance. Car parts C and D. Visitors and staff. The Simpson Center for Reproductive Health. Gynecology emergency. Maternity emergency. Neonatology emergency. Outpatient departments. All wards. Day surgery unit and endoscopy. X-ray department. And combined assessment. Outpatients. Dr. Barron, the accident and emergency department, also called casualty, is where patients who are acutely ill with a sudden serious condition come for assessment and treatment. Outpatients who have an appointment to see a specialist go to a clinic in one of the outpatient departments, OPDs. They have usually been referred to the hospital by their GP, who writes a referral letter to the consultant explaining the patient's problem. Inpatients. Dr. Barron, the inpatients in a hospital are admitted in one of three main ways. They may be seen in one of the outpatient clinics and admitted from there, or if there is a lot of demand for the treatment they need, as in the case of a hip replacement, they are put on a waiting list for admission. Alternatively, their GP may arrange the admission by telephone because they are acutely ill, for example, with suspected myocardial infarction, or they are seen in the AME department, where the doctor on duty working at the time arranges the admission. This would happen in the case of a patient with a fractured neck or femur. For example, larger hospitals may have an assessment unit where patients can be admitted temporarily while their condition is assessed. Jordi, assessed? Dr. Bayron, yes, decisions are made about their condition and what needs to be done to help them. After treatment is completed, the patient is discharged back to the GP's care. Exercises. Exercise 9.1. Complete the table with words from A, B, and C opposite. Put a stress mark in front of the stress syllable in each word. The first one has been done for you. Admit, admission, assess, assessment, discharge, 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 operate, operation, refer, referral, treatment. 9.2, make word combinations using a word from each box. Look at C opposite to help you. Acutely ill, assessment unit, on duty, referral letter, waiting list. 9.3, which hospital departments would be most appropriate for the following patients? Look up A, B, and C opposite to help you. A woman in diabetic coma, intensive care unit, ICU. A patient who has just had a radical prostatectomy, high dependency unit, HDU. A patient with to have a skin lesion removed. Day surgery unit. A man with a foreign body in his eye, accident and emergency department. A woman with a three nap abortion, gynecology emergency. 9.4, complete the extract from information leaflet for patients. Look at A, B, and C opposite to help you. Information for outpatients. When you arrive at the clinic or hospital, please tell the receptionist who will welcome you, check your details, and direct you to the waiting area. The length of your visit will depend on the treatment you are going to have. You might need to have some tests such as X-ray, which could mean going to another department. Or you may be referred to other professionals such as physiotherapists or dietitian. You might need to revisit the clinic if staff at the clinic want to see you again. Another appointment will be arranged for you. If you need to be admitted to hospital for more treatment, either as an inpatient or for day surgery, you will be told when this is likely to happen. If you do not need further treatment, you will be discharged to your GP's care.